Title: Trauma and PTSD, A Comprehensive Exploration. Introduction: Trauma is a deeply distressing or disturbing experience, often leaving long-lasting emotional and psychological impacts on individuals. Post-traumatic stress disorder, PTSD, is one of the most well-known outcomes of trauma, particularly after exposure to life-threatening or horrific events. While trauma is a common human experience, PTSD is a more specific response that occurs in some individuals. This article aims to explore the complexities of trauma, its manifestations, and the clinical framework for understanding and treating PTSD. Definition of trauma: Trauma refers to an emotional response to a disturbing event or experience. Trauma can stem from a wide array of incidents, including accidents, natural disasters, violence, emotional abuse, or the sudden death of a loved one. Trauma is not limited to one type of event, nor is it exclusive to one demographic. Trauma can be acute, chronic, or complex. Acute trauma is linked to a single event. Chronic trauma is related to prolonged exposure to distressing events, such as domestic abuse. Complex trauma refers to exposure to multiple traumatic events, often involving interpersonal violence. Types of trauma. 1. Acute trauma, typically associated with a single overwhelming event, such as a car accident or sudden loss. 2. Chronic trauma, linked to ongoing stressors, like long-term abuse or ongoing conflict. 3. Complex trauma, results from exposure to multiple traumatic events, usually of an interpersonal nature. This is often seen in survivors of childhood abuse, domestic violence, or prolonged neglect. 4. Secondary/vicarious trauma, experienced by those who are indirectly exposed to trauma, such as caregivers or first responders. 5. Developmental trauma, early childhood exposure to trauma that impacts developmental processes. Psychological impacts of trauma. Trauma significantly affects mental and emotional health. Victims may experience flashbacks, intrusive thoughts, nightmares, and anxiety. Emotional responses vary widely and can include feelings of helplessness, rage, sadness, or guilt. Other common psychological effects are depression, difficulty concentrating, dissociation, and emotional numbness. Prolonged exposure to trauma can lead to severe psychological disorders, such as PTSD. Understanding PTSD, post-traumatic stress disorder, PTSD, is a mental health condition triggered by experiencing or witnessing a traumatic event. It is characterized by intrusive memories, avoidance behaviors, negative changes in thinking or mood, and heightened reactions to stress, hyperarousal. While not everyone who experiences trauma will develop PTSD, certain factors, such as genetic predisposition, past trauma, and lack of social support, increase the likelihood. History of PTSD. PTSD, though recognized officially by the American Psychiatric Association in 1980, has existed under different terms throughout history. During World War I, the condition was called shell shock, and during World War II, it was known as combat fatigue. While initially seen as a disorder related only to combat veterans, the understanding of PTSD has broadened to include individuals who experience various non-combat traumas, including sexual assault, accidents, and natural disasters. The understanding and treatment of PTSD have continued to evolve, incorporating both psychotherapy and pharmacological interventions. Symptoms of PTSD. PTSD is often divided into four main symptom clusters. 1. Intrusive thoughts, recurring, unwanted memories of the trauma, flashbacks, or nightmares. 2. Avoidance, steering clear of reminders of the trauma, such as people, places, or activities that are linked to the traumatic experience. 3. Negative changes in mood and cognition, persistent negative thoughts, distorted beliefs about oneself or others, and difficulty experiencing positive emotions. 4. Hyperarousal, heightened reactivity to stimuli, which may include being easily startled, irritability, difficulty sleeping, or hypervigilance. Risk factors for PTSD. Several factors contribute to the development of PTSD, including the severity of the trauma, proximity to the traumatic event, and an individual's history of prior trauma. Biological factors, such as genetic predisposition, also play a role. Environmental factors, such as a lack of social support, increase the risk. Certain demographics, such as women and individuals who experience interpersonal violence, tend to have higher rates of PTSD. Diagnosis of PTSD. Diagnosing PTSD involves an assessment by a mental health professional, who will conduct a comprehensive interview to assess the presence of symptoms in alignment with the criteria outlined in the DSM-5. The DSM-5 requires that symptoms last for more than 1 month and cause significant distress or impairment in functioning. A full diagnosis also considers the impact of the trauma, pre-existing mental health conditions, and the individual's environment. Effects of PTSD on physical health. PTSD doesn't just affect the mind, it can also lead to physical health issues. Chronic stress from PTSD may result in cardiovascular problems, such as high blood pressure and heart disease. Additionally, PTSD sufferers may experience gastrointestinal issues, chronic pain, or a weakened immune system. Insomnia and other sleep disturbances are common, further impacting overall physical health. Treatment options for PTSD. Effective treatments for PTSD often involve a combination of psychotherapy, medication, and lifestyle changes. 1. Psychotherapy. Cognitive behavioral therapy, CBT, particularly trauma-focused CBT, is a commonly used therapeutic approach. Eye movement desensitization and reprocessing, EMDR, is another effective therapy that helps individuals process traumatic memories. 2. Medication. Antidepressants, such as selective serotonin reuptake inhibitors, SSRIs, are often prescribed to help with the anxiety and depression associated with PTSD. 3. Complementary therapies. Practices such as yoga, meditation, and acupuncture can also provide symptom relief for PTSD sufferers. 4. Support groups. Group therapy or peer support groups allow individuals to share their experiences and receive validation and empathy from others with similar struggles. Cognitive behavioral therapy, CBT, is the most widely researched and evidence-based treatment for PTSD. It helps individuals understand and change their patterns of thinking that are contributing to their distress. One of the core components of trauma-focused CBT is exposure therapy, where the patient is safely and gradually exposed to trauma reminders in order to reduce their power over the individual. Another key component is cognitive restructuring, where patients work with therapists to reframe negative thoughts and beliefs associated with the trauma. EMDR, Eye movement desensitization and reprocessing, EMDR, is an evidence-based therapy for PTSD that involves the patient recalling traumatic memories while the therapist moves their finger back and forth in front of the patient's eyes. The goal is to help the patient process the trauma in a new, less distressing way. EMDR is based on the theory that trauma disrupts normal cognitive processing, and bilateral stimulation, such as eye movement, can help reprocess these memories in a more adaptive manner. Medications used in PTSD treatment. Medications can play a crucial role in alleviating symptoms of PTSD, particularly in cases where anxiety, depression, or insomnia are pronounced. The primary medications used include selective serotonin reuptake inhibitors, SSRIs, such as sertraline and paroxetine, both approved by the FDA for PTSD treatment. Other medications may include mood stabilizers, anti-anxiety medications, and sleep aids, depending on the individual's symptoms. Medication is often used in conjunction with psychotherapy for the best outcomes. Coping strategies for PTSD. Learning to manage the symptoms of PTSD is essential for recovery. Common coping strategies include practicing mindfulness, developing a support system, and engaging in regular physical exercise. Breathing exercises and progressive muscle relaxation are useful for reducing anxiety and managing hyperarousal symptoms. Journaling can help individuals process their emotions. It's important to recognize personal triggers and develop healthy ways to respond when they occur. The role of social support. Having strong social support systems is a critical factor in recovering from PTSD. Family, friends, and support groups can provide comfort, understanding, and practical assistance. Involvement in social activities, even if challenging, helps individuals avoid isolation, which can exacerbate symptoms. Research consistently shows that those with more social support experience fewer PTSD symptoms and have better treatment outcomes. Trauma-informed care. Trauma-informed care is an approach that acknowledges the widespread impact of trauma and the importance of understanding paths to recovery. It recognizes the signs and symptoms of trauma in patients and seeks to avoid re-traumatization. Healthcare providers are trained to create a safe, supportive environment that promotes healing. Trauma-informed care is particularly important for survivors of interpersonal violence, abuse, or combat. Cultural perspectives on trauma and PTSD. Cultural beliefs and values significantly shape how individuals understand and respond to trauma. In some cultures, trauma may be expressed somatically, with physical symptoms rather than emotional ones. Certain groups may also have unique forms of trauma, such as historical trauma in indigenous communities or intergenerational trauma in families affected by war or displacement. It's important that treatment for PTSD be culturally sensitive, recognizing that different populations may have distinct ways of conceptualizing mental health and recovery. The role of resilience in trauma recovery. Resilience is the ability to adapt in the face of adversity, and it plays a significant role in how individuals cope with trauma. Protective factors, such as strong social connections, a sense of purpose, and access to mental health resources, enhance resilience. On the other hand, risk factors, such as poverty or pre-existing mental health conditions, can diminish resilience. Building resilience is often a focus of trauma recovery, involving practices like fostering emotional regulation, developing coping skills, and reinforcing social bonds. Conclusion: trauma and PTSD present complex challenges that affect individuals psychologically, physically, and socially. Understanding the intricacies of trauma, including the various forms it takes, helps illuminate the multifaceted nature of PTSD. With proper treatment, including evidence-based therapies, medication, and strong social support, individuals can manage PTSD and lead fulfilling lives. Ongoing research into trauma and PTSD continues to enhance our ability to provide effective interventions, helping survivors reclaim their mental and emotional well-being. Thanks for watching the video.